All right, Maddie, thanks so much for doing this. My first question to you is tell the audience a little bit about yourself and how you started in the area of mental health.
Yeah, absolutely. So my name's Maddie Hundley. I used to be Maddie Sheffer, but I got married and so my name changed. But I'm a licensed marriage and family therapist. I'm licensed in California and now recently Texas. But I also work as a coach to people all over the world. And I specifically work with intimacy coaching. I work with couples who are struggling with low libido and desire discrepancies. I work with a lot of people who are in kind of alternative relationships, people who are queer, people who are just navigating what's going on within their intimate lives. And so I have worked for the last decade really specifically focusing in this. And yeah, now I'm in private practice and I see my clients each week and that's what I'm doing. And my company is called Zillennial Intimacy, and that's me.
hmm So tell me a little bit about some of the work that you do as a clinician. What do you sort of work on with these individuals? Because you work with a lot of populations and a lot of groups.
Yeah, absolutely. So it depends. Every client that comes in is really different. People's needs really change based on what's going on in their life. And so I work from a narrative perspective, and all therapists are so different. And maybe if you've been to therapy, you notice that like speaking to one therapist is totally different than speaking to another. And it's because we all have this different theory of change or how we think that people are going to feel better. And the way that I think people feel better is that we have this internal narrative or this external narrative that we're either telling people or we're telling ourselves. And it has, our narrative has some problems. It's not making us feel good. And so a story that is about sadness and things happening to you can become a story of redemption and success. And so that's like a very, very um, simple way to explain it, but yeah, my work really changes depending on the client. It depends on if I work with a couple or an individual. Um, and yeah,
hmm My next question is like what do the sessions look like when you work with individuals? Because often like you said, it depends on what client you're working for, but what do the sessions look like, so to speak?
absolutely. Um, so I work virtually only, which is great. I love working from home. But what that means is that sessions that I have with clients are really flexible and can be at their own time that's convenient to them. And we basically find a time and we do something like this. So either on Zoom or a different platform. And we start the session very similarly to maybe how you would start a session or start a conversation with a friend. And really good outcomes of therapy are really dependent on people having good rapport with their therapists. So the biggest thing is realizing it's like figuring out, do I have a good connection with this client? Do they have a good connection with me? And so the sessions in the beginning really look like us trying to understand who we're talking to and if we feel comfortable talking to each other.
hmm What particular modalities do you use when working with patients?
Yeah, so as I mentioned, I work from a narrative perspective mostly, but I'm pretty eclectic. And what I mean is I use a lot of solution-focused methods because in sex therapy, there are a lot of things that are just not very, um, they're not about mental health as much as they are about kind of action-focused things that people can be doing. So I work from a solution-focused, I work from a feminist perspective, and what that means to me is that like we don't exist in a vacuum, and that there are pressures that push on all of us in different ways, and um, depending on our level of privilege. And um, yeah, I think kind of lost track of where I was going with that, but did that answer your question?
Yeah, I was gonna ask, could you explain those things a little further for those who don't know?
Yeah, absolutely. Um, so the narrative perspective, I think I explained, we have this narrative that we build, and my goal is to help us break down all of that, kind of figure out the different boxes that we have with different information, sorting through them, and then rebuilding that narrative back together. And because I'm using perspectives that are more solution focused, what that means is that I'm giving people homework. And I always say there's only homework if you want there to be. Um, but I'm a resource queen and I give lots of people book recommendations and podcast recommendations. And it's a very interactive experience. And so the modalities that I use really change depending on the client and what they need. Some people need unconditional positive regard. Some people need somebody that's going to be like confrontational. And so a lot of this is kind of an art, is figuring out how can I be the best help that I can be to each person.
Mm-hmm. Do you sort of like in those sessions, do you like role play with the person? Just because I'm trying to get a sense of what that sort of session would look like. How would it sort of play out?
Yeah.
Um,
Yeah, I know, and I think your question is really valid because a lot of people think like, what is therapy? Like, how is therapy different than just talking? And a lot of people who are very self-aware, maybe they come to therapy and they say, this is what I did for the last 2 weeks. This is what's going on for me, and maybe they spend the whole session just kind of talking out this kind of internal dialogue that's going on for them. And other times it looks like me, when I know the client a little bit better, it looks like me saying, "Hey, do you notice that this thing you just brought up is like actually um, very present in this other area?" And so it looks like a free-flowing conversation that goes where the client needs to go, with me as the guide. And so the client pretty much feels like they're just talking, just, stream of conscious talking. And I'm making sure that that client is really staying within the path of growth.
hmm What are some of the common themes that you've noticed when working with patients?
Hmm. The themes I normally see, I don't know if this is what you're asking. Um, are you asking like what are the most common types of clients that I see and like the themes that come up with that?
What are the most common types of themes that you see when interacting with patients?
Yeah. Um, well, the first thing I see is that when people start therapy, they're very, very worried to say the right thing, do the right thing. And um, I've noticed that people are very nervous in their first sessions. And so it's my job to make them feel
hmm
a lot less nervous and make them feel comfortable to talk to me. And um, you know, I think the patterns that I see with clients, my couples, a lot of times, there's this dynamic that comes up all the time that's very interesting, where we have one person desiring intimacy more than the other person. And a lot of times that looks like the guy wants sex more than the girl wants sex. And what that kind in those binary terms, what that looks like is that there's a lot of distance between the partners. And so the repeated thing I keep seeing is partners that have very little conflict, emotional conflict, but they have this huge, huge discrepancy in their intimate life. So that combined with just like the shame that I see in most clients when they come is the pattern that I think is like most pervasive in therapy.
Yeah, it's like this idea where like a couple where one person, like you said, wants one thing, but the other person not so much, you know?
Mhm. Yeah, exactly. And like, where do you go from there? I mean, you want your needs to be met, but you also don't want to force somebody to do something they don't want. And, um, the marriage is really complicated. Living with somebody is really complicated, and trying to stay with one person for a very long time as we change and shift and grow in our lives, takes work. And so couples therapy is this like beautiful playground where we get to explore. I always say that therapy is like this microcosm. And so the things that I notice in our microcosm are probably happening outside of here. So if I notice when I'm talking to you that maybe emotion isn't coming out and I'm not noticing your emotion as much as other people. Maybe that's happening in other areas of your life where other people can't see the emotion. And so it's really interesting for us to be able to pick apart our own relationship within therapy.
Like what sorts of modalities do you use to really help those couples in those types of situations? Because I'm sure you've heard of um the Gottman method, EMDR, but what specific modalities do you use for your particular work in terms of helping couples, navigate how they
Yeah.
want to live their lives? Um,
Yeah. So I have a lot of training in sex therapy and currently finishing up with the American Association of Sexuality Educators, Counselors, and Therapists. And um, through that, I um, I'm sorry, would you repeat your question one more time so I can make sure I answer it correctly?
yeah, like what modalities do you use to help couples going through that sort of phase in that relationship?
Right. So the Gottmans are wonderful. The Gottmans are a married duo that did a lot of research that showed that, the number of arguments or how bad the arguments are, it doesn't actually matter in terms of the success in the long term, like how long term the relationship is. It actually really is dependent on repair. And so repair looks like that big deep breath after you've been feeling bad for a long time. Repair looks like feeling comforted with each other. And so I do use pieces of the Gottman method. I also use pieces of Esther Perel's work, if you're familiar with her.
Mm-mm.
Esther Perel's wonderful. Um, so many wonderful books I have on my shelf actually here. There's The State of Affairs, which is really wonderful for people who are going through anything with infidelity. And then there's also Mating in Captivity, which is a really common book for people who are in relationships and marriages. I really recommend both of those. So I use a lot of the stuff that is in those books. Emily Nagoski is another person that I really use a lot of methods from. And so Emily Nagoski has written Come As You Are, which is like this totally transformational book for a lot of women who read it. There's a lot of pieces of women's intimate sexual lives that are never really discussed. And I think that book is just really helpful at making people feel normal, less shameful, that kind of thing. And then, I should mention that I use a lot of the stuff from my own book. I wrote this book.
Mm-hmm.
Um, and I have everything from like stuff about attachment styles and negative core beliefs. There's so much stuff in here, but um, truly, this probably is what I get most of my stuff for couples from.
Mm-hmm. If I could ask about your book in particular, why did you decide to write it? What was the reason?
I started writing the book because I felt like therapy is so incredibly expensive, and I felt so uncomfortable that I was saying the same darn things every time I was talking to couples. And I was like, I'm wasting their time. They're spending so much money on this time with me, and I could just write this in a book and give it to them. So my book is called Different Me, Different Us, the readable part of couples therapy. I don't like to read all that much, or I don't have time to read all that much. So I wrote every chapter to be just a couple of pages. Um, Everything is very simple. You can open it to whatever part of the book you want, and it makes sense. And so I am neurodivergent, I have ADHD, and so I wrote this book because I wanted it to be a simple book that I could throw at people before they waste their money so I can tell them.
Yeah, I have a lot of books myself, but I don't necessarily read them. So
Yeah,
yeah, yeah.
exactly.
My next question is like, what have you learned in doing this type of work, and what do you still hope to learn in terms of something new? So it's a two-part question.
Yeah, so say it one more time. I want to make sure I answer it the way I want.
Yeah, what have you learned in doing this type of work with couples, and also what do you still hope to learn
Got
in
it.
the future in terms of something new?
Well, the more I learn, the more I realize I don't know anything. I think that's how it is for a lot of things. You feel like an expert at first, and then you realize, holy cow, there's so much information that I have to get to. What I want to do in the future is really carve out a modality of my own. I know we've been talking about modalities together, and truthfully, what I want to say is like I want to have my own modality. So I've been kind of quietly working on that for a while, and I'm sure it will take a few years to kind of get to where I want it to be. But um, my next book might be more about theory and modalities for clinicians rather than for clients. My first book was really for clients. Um, but you know, more than anything, what I've learned in the last decade of this work is that um, it's all about shame. every single part of what causes pain in people's life is shame and trauma. And the DSM, which is like the Bible of diagnosis that insurance companies use. And um, it's important that we don't think of mental health so binary. I think um, that just realizing that trauma is so pervasive, that shame is so pervasive, those are the things that I feel like I've learned so much about, and that everything I learn kind of helps me figure out how to bring less shame to the conversation. And so people are able to talk to me about things that I know would make me so uncomfortable to talk to anyone about. And so I just feel so grateful that people trust me, that people like talking to me. And I love that they give me like a sliver, a little window into what their life is like. So I've learned a lot about um, just shame and how rewriting your narrative can be so powerful. That the Grand Canyon looks totally different looking from the top down than it does from the bottom looking up, and it's the exact same story.
Mm-hmm.
Um, so yeah, perspective, I think, was how I would answer it.
Yeah. It's sort of this idea where mental health is not, like you said, a binary choice, but it's the mind and the body, you know? It's all connected.
Absolutely. And somatics is something I haven't mentioned that I'm so passionate about, because so many people come to therapy and they're so emotionally intelligent and they say, okay, I had all this trauma from my childhood and I know that's why I'm this way today. Well, great, but I'm sure you still feel bad. And so, what I like to have those people do is really get in touch with the somatic connection to their emotions. So, I'm feeling anxious, but where is that located? What a silly question. Where is it located? But it's located somewhere in our body. Maybe it's a lump in our throat. Maybe it's our ears are hot. Maybe we have tickles all, our our hair is standing up. There's so many different ways that our bodies show us that we're having emotions. And so really getting in touch with the somatics helps you navigate through your emotions so much clearer.
Mm-hmm. Lastly, to wrap this up, what advice would you give to the mental health professionals that are, that want to learn more about mental health and that want to learn more about sex therapy and all other types of therapies? Because it's really fascinating.
Super fascinating. Um, well, I'd love to just promote what I have on my website. I've got tons of blogs and all sorts of information that I think is really interesting and important. So, there's a place to start. But there are also tons of organizations out there that help people learn more about this. There's the Sexual Health Alliance, who puts on different conferences for people who are specifically looking to become certified in sex therapy or sex education. There are programs at universities like University of Michigan where you can get a certificate after you get your master's, and you can get the same training. But really, the kind of gold standard is ASECT, the American Association of Sexuality Educators and Counselors, and Therapists. I said it wrong, but um, the way that you can get like into this field is by surrounding yourself in the community of people who talk about this. So going to conferences, having one-on-one conversations with people who are sex therapists. That's the way that you can really like get your foot in the door. Um, but if you're interested in just learning more about it, it's all on my website. So that's where I
Mm-hmm.
would direct people.
Yeah, it's a whole list of resources, I guess.
Yeah, yeah. Again, I'm the resource queen, so
Yep,
it's
yep, that is true. All right.